Hi, today we're going to be talking about sciatic pain during pregnancy, and we'll go through a few gentle and simple exercises to help you work through this pain. Now, if you're new to Element, welcome. My name's Jennifer. I'm a Pilates and yoga teacher, and I specialize in women's health. If you'd like to keep up to date with new pregnancy videos and tutorials to help you throughout your journey, don't forget to hit that subscribe button. Now, for our workout today, you will need 2 big cushions or yoga bolsters, and you'll also need a chair for the workout too. So when we talk about sciatic pain, we're generally referring to 2 different conditions. The first is sciatica and the second is piriformis syndrome. Now, your sciatic nerve originates between the lowest 2 vertebrae in your lower back. It runs down through your hip and then down through the legs on both sides. Now, if the lower back discs get compressed, and that can happen through postural problems, disc degeneration, or any kind of bulging or slip discs, this can put pressure on the sciatic nerve from its origin point, which then creates that irradiating pain. Now, during pregnancy, our posture tends to change quite dramatically. We end up with a very extended lower back. And if your back is overly extended and those discs start to compress on the nerve, that's what can create the pain during our pregnancies. Now, the other condition, piriformis syndrome, refers to more of a localized issue at the hip joint. So your piriformis muscle is a deep hip rotator muscle, and it sits very close to the sciatic nerve. When that muscle gets inflamed, which again is something that's very common throughout pregnancy because we have a lot of extra load and weight on our hips, those muscles are working really hard and overtime to try and support us. If that muscle gets inflamed and starts to press on the sciatic nerve, that's what can create that pain. Now, while these conditions are similar, generally with piriformis syndrome, the pain will be localized in at the hip, whereas with sciatica, it generally does tend to run all the way down the leg. Both can be extremely painful and can make really simple everyday activities like walking and sitting to standing really difficult. So while the exercises that we do today will be helpful at gently treating both conditions, it's crucial that you see your doctor or your physio to get a proper diagnosis. That way they can rule out anything else that might be happening through your body. Now, if you're experiencing acute pain, if it's difficult for you to walk or stand easily, then I recommend you talk to your doctor about pain relief to reduce that inflammation, getting your pain down to a point where it's manageable before you start these exercises. Okay, to start, let's grab one of those bolsters or cushions and sit on it so that you're propped up nice and tall. Now, it's crucial that we learn to work in a nice neutral spine with these exercises. That way we know that we're not putting any additional pressure on the sciatic nerve, and we're lessening that pressure into the hips here as well. So just find a place that you can sit up nice and tall. Have your arms released along beside you. Give your shoulders a little bit of a roll out just to loosen up any tension around the neck or the upper back here as well. And then let your head drop from side to side. Good. So we'll begin by mobilizing through the upper part of the spine. Take an inhale and reach your right arm above you. On your exhale, gently side bend your body over and across, reaching out through the fingertips, just creating space from the rib cage all the way up into the arm. And then inhale, let's come up. And then exhale, lower. Other side, reach with that arm. And then side bend over. Good. So let's keep going with those, gently alternating from one side to the other. So the more movement that we can create through our upper and our middle back, the less pressure we tend to put onto the lower back. Okay, so if you can create movement and reduce some of that tightness that we tend to feel through our shoulders, our chest, and our upper back during pregnancy, it means we can get more freedom through that upper spine, and hopefully we use our lower back a little bit less. That's it. Let's do one more here each way. Reach the arm up, control it over. That's it. Last one. Good. Now make your way back to the middle and let's add a seated twist. So again, just keep your legs relaxed. Make sure you're sitting up tall. Rotate around to one side. You can use your hands to help twist you. Open the chest and gently look over your shoulder. As you inhale, come back to the middle. And then exhale, let's twist to the other side. And again, rotate and twist. Let's just keep those going. So again, trying to get as much movement around that middle and upper spine as we can. You can let your belly be soft here as well. Let's do one more each way. That's it, great work. And then make your way back through the center. Good, sit up tall again. Just give the shoulders another roll and hopefully feeling a little more released through the upper back. If you're not, then feel free to pause the video and add a few more stretches here if you have to. Now, when you're ready, we'll move carefully off the bolster or the cushion. Just place it off to the side and let's make our way into all fours. Bring your hands flat down onto the mat, directly underneath the shoulders. Knees are underneath your hips. So let's start here by again finding that neutral line. Good, you want a straight position through the back of the hips, back of the shoulders up to the back of the head. Press gently up and away from the floor so you're supporting yourself with your arms and your shoulders. Now let's practice here our core and pelvic floor connection. Take a deep breath in to prepare. Now on your exhale, lift and engage through your core muscles. Feel like you're drawing your baby up and into the spine. Find that gentle lift of your pelvic floor as well. Now we haven't changed the shape of the back in any way. We're maintaining that neutral position. And then relax the muscles and take another deep breath in. Let's do that again. Exhale, lift and engage your core. Lift through the pelvic floor muscles. And then release, take a breath in. Let's keep going with those. So the more we can teach those core muscles to support our lower back and our pelvis, while we're in a nice neutral spine position, the more support we're going to have in keeping the body in that alignment. That's it. Now when you lift and engage your pelvic floor, it's a gentle, small lift. Feel like you're stopping the flow of urine. And you're also trying to stop yourself from passing wind. So it's a connection at both the front and the back of the pelvis. That's it. Make sure you're still pushing up through your shoulders. Let's do one more. Now lift and engage your core. Good. Lift through the pelvic floor and just hold this here for 3, 2, 1, and release. Good. From there, just take a moment to reset. Now, keeping your core muscles engaged, keeping that lower back in neutral, so that small natural curve behind your lower spine. Just start to rock your hips very gently from side to side. So we don't want to be bending into the back. Here, all we're doing is releasing a little bit of tension through the hip sockets and the back of the pelvis. So you want to keep a gentle core connection here at all times, just to support the lower back. Good. Now, if any of these exercises do tend to aggravate any discomfort around your hip or your sciatic pain, ease off. All right. Keep them really small, really gentle, but some may be better for you than others. So you just listen to your body. That's it. Now let's make our way back into that center position. If you've got quite a big belly here, you may need to now take your knees even wider, maintaining a straight line through your back. Let's start to shift the hips back and forth. That's it. Nice strong arms. Keep a gentle core connection, keeping that lift of the pelvic floor. Being careful not to round the spine. So leaning your hips back only as far as you can maintain neutral. That's it. Keep pressing back into the hips and release. We'll do 2 more of those. And exhale, leaning back into hips. Inhale up. And 1 more. And release. Well done. Now bring your knees right back underneath your hips. Carefully come up to a high kneeling position. Now we're going to stretch out gently through our hip flexors at the front here. During pregnancy, as we get bigger and bigger through our belly, we tend to end up with tight hip flexors to accommodate for that growing weight. And that can end up pulling your pelvis into an anterior tilt, that really extended lower back position. And again, if that happens and it does create that pressure on the lower back and compresses the sciatic nerve, that's what can create that pain. So we're going to try and release the hip flexors to allow you a little bit of relief. Let's carefully step one foot out in front of us. Now make sure your front foot is flat, your bottom knee is resting down just directly underneath your hip. Start by tucking your pelvis under. Now straight away, especially if you're in later stages of pregnancy like me, that should give you a stretch in your hip straight up. Now to deepen that stretch, let's bring our hands onto the sides of the pelvis. Good. Now keep your belly soft here. Good, but really mindful of maintaining a neutral position of the lower back. So you can use your glutes, your bottom, to tuck that pelvis under and support you. Good, but keep the belly soft, okay? That way we're not pulling any tension as we add that stretch. Now let's start to lean those hips forward. And then bring it back. That's it, lean the hips forward. And bring it back. Couple more of those. Now last one, just lean the hips forward, stay there, really opening out your hips. Tuck that tailbone, press into it just a little bit more. Hold it here for 3, 2, 1, and release it. Very gently and carefully swap your legs. Good, other foot comes out in front. Make sure that foot is flat. Remember, we start by tucking under through the pelvis, really open through that front hip flexor first. And now if that's enough of a stretch, remember you can just stay here, or we start to deepen it by shifting forwards and backward. Should give you quite a lot of relief. That's especially if you're feeling tight in the hips generally as well. And backward. Let's do that once more. And then lean into those hips. Just hold that position. Good. Breathing here for 3, 2, 1, and release. Good. All right. From there, we're going to make our way back down onto the mat, and I want you to grab those 2 big cushions or bolsters. Stack your cushions or bolsters one on top of the other, making sure that they are nice and stable. Now bring your body into the position on the mat where you have your back to the cushions, leaning your shoulder blades back onto them. Walk your feet in slightly, again, just keeping some space here for your belly. Your feet are flat and about hip distance apart. Now I want you to keep your back as straight as possible. Take your hands behind your head and lean your shoulders back over the bolsters, resting your head as well. So it's important not to be pulling our head and neck forwards, especially during later stages of pregnancy, as we don't want to be putting any pressure onto the front of the abdominals. From here, I want you to press down through the heels of the feet, engage your glutes, your bottom muscles, and gently lift your hips up into a straight line. Now we've just stretched out those hip flexors at the front of the pelvis, so we should be able to get that pelvis up without feeling too much tightness across the front of the hips. That's it. Now from there, I want you to keep that squeeze of the glutes. Gently inhale and lower your hips down towards that mat. And then exhale, press the hips and lift up. Let's keep going with those. Inhale to lower. Exhale up. So as all of our other exercises here, it's really important that we maintain a straight line through the back. Good. For our exercise here, we can engage the core and the pelvic floor muscles once again. So the stretches, we try to relax the core, but the exercises, we try to engage. That's it. Really firing up those muscles through the back of the hips. Make sure the knees are staying in line with your pelvis. Let's continue with these. So we often perform this exercise laying flat down on the mat. However, in later stages of pregnancy, we don't like to bring the body up into an incline, all right, or an inversion. That way, it can make some women feel a little uncomfortable or nauseous. So adding this support under the shoulders to prop us up means that our hips don't come up any higher than parallel. But let's do 2 more. We should be starting to really feel those muscles around the back of the hips and the back of the legs. Now, last one, let's lift up and stay there. Now, hold your hips high. Keep those knees in a parallel. Really squeeze those glutes. Keep your core connected as well. Deep breaths. Let's hold for 3, 2, 1, and then gently lower the hips down and return. Now, to safely come out of this, just take your hands around the back of the thighs and use your arms to help pull you up to sitting. Great job. Okay, you can remove these bolsters or cushions, and we're going to work now with the chair. So find a comfortable seat, making sure you can place your feet flat down onto the mat. Now I want you to lift and cross one ankle over the opposite thigh here. Again, it's really important that we keep that back straight as we do so. Now, opening out this front hip may be enough of a stretch, okay? We want to feel a gentle release around the side of the pelvis. If you're not feeling much of a stretch here, what we can do is start to lean forwards, keeping that gentle stretch, okay? So we don't force it. If you're still not feeling much of a stretch, you can also press that knee down towards the floor. Find a position that feels like the muscles are stretching, but you're not pulling any tension onto the lower back or the pelvis. And avoid starting to round and collapse the body down. So as much as we can, we stretch out into the back. So we're going to hold this stretch for about 30 seconds. Good. Now you can work up to about a minute with this stretch if you think that you need to hold it for a little longer to get a deeper release. That's it. So with that stretch, you can let that belly be soft. Just take nice deep breaths. That's it. Let's hold here for one more breath. And then very gently release the spine back up straight, and then take that leg down onto the floor. Good. And then when you're ready, take the other leg up and over. So even if you're only having sciatic pain on one side, it's important that we stretch out both hips so that we don't feel unbalanced. Again, lengthening up through the body, start to lean forward if you need that extra stretch. Good, gently press that knee down to the mat if you need to go a little bit more into it. You may find that one side is tighter than the other, which is really common. So if this is your tight side, just be gentle with it. So we're holding for about 30 seconds. But remember, you can work up to holding for about a minute if you need as well. Deep belly breaths. Let your core muscles be soft and relaxed. That's it. Let's hold here again. One more breath. And then gently come back up. Great work. Bring those feet down onto the floor. Let's make our way up to standing, and then turning around to face the chair. We're coming into a standing variation of downward facing dog. So you want to have your hands resting on the chair at about chest height. So whether you need to grip the outside, or maybe you can even rest your hands on the top. Walk your feet back until your body is parallel to the floor. Have your feet at least hip distance apart, maybe a little bit wider if you need to accommodate for a bigger belly. Now your knees are soft, stretching out through that tailbone. Try to create that natural curve of the low back. Reaching your arms out in front. Now, if you're really struggling to straighten out your back here, if you feel like you're quite rounded, bend your knees even more. And that will allow you to create more space in the lower back. Otherwise, if you can find that nice straight neutral line through the spine, you can straighten out the legs a little bit more so you create that stretch deeper up into the back of the legs as well as the lower back. That's it. Hold that there again. Let your belly be soft. You're going to hold here for 30 seconds, but again, you can work up to about a minute if you can. Relaxing the shoulders away from the ears. Let's stay here and take one more deep breath. And now to come out of it safely, bring your hands down onto the chair and use your arms to press you all the way up. Good. All right, to finish our sequence today, let's just take a seat back on that chair. Have your feet again flat onto the floor, about hip distance or more apart if you need. And let's just practice our good seated posture. So if you are experiencing sciatic pain, try and avoid really sinking or slouching when you're sitting down, all right? As much as we can keep a nice, tall, neutral line, good, the better you're gonna be for giving your pelvis and your spine a little bit of relief. Now let's lengthen up through the crown of the head, roll those shoulders back and down. So the rib cage is just sitting back over the hips. Slightly draw the chin in to create length in the back of the neck. Let's practice engaging our core and our pelvic floor muscles one last time. Deep breath in. On your exhale, lift through the pelvic floor. Lift your baby up and in towards the spine. Hold that there for 3, 2, 1, and release and lower. Take a deep breath in. Let's do that once more. Exhale, lift and engage the core. Lift the pelvic floor. Holding for 3. Hold 2. Hold 1. And release. I hope this sequence has given you a little bit of relief from sciatic pain. If you have any questions, please place them down into the comments below. I also have a free prenatal health and exercise guide available. This details all of the things that we should and shouldn't be doing in terms of exercise throughout pregnancy. If you would like a copy of that, you can follow the link which I've listed down into the notes. Thank you again for joining me, and I'll see you soon.